guys, Dr. Nathalie here, and I thought I'd just do a quick video because I'm getting asked all the time what by patient, what vitamins they should take. So obviously there's no one answer to this, but I always talk about the Fantastic Four because I really believe that everyone should be on those 4 supplements. And why? Well, the quality of our food is not what it used to be. The quality of our soil is not what it used to be. So even if we're trying to really eat well, we are most likely not getting all the nutrients from the food that we eat. So the first one, therefore, is a good multivitamin. And when I say a good multivitamin is that some companies are better than others because some companies will use more fillers and binders, therefore you end up with more byproducts that you don't really want in your multivitamin. So multivitamin is the first one. The second one that is so important are probiotics. And again, I get all the time, but Nathalie, I'm eating tons of yogurt. I take a big breath and I just go, okay, but yogurt is not the best way to get your probiotics. Multitude of reasons, I have a whole section in my book about that, but the sugar that is present in the yogurt almost makes it counterproductive to the purpose of the probiotics or the live bacteria themselves. So make sure that you get a good, high quality probiotic with a multitude of strain. You're better off with that than with your yogurt for the sugar content. And then also in the yogurt, it's a dairy product, so it's not meshing as good as the bacteria that are in supplement as us human beings. And on top of that, some people don't do well with dairy products themselves, and they shouldn't be eating those dairy products because they have GI issues. So probiotics, I kind of joked, you know, the old MasterCard, no, was it American Express commercial, don't leave home without it. Well, I don't leave my home without taking those Fantastic Four, and especially the probiotics, because knowing that 80% of our immune system is in our gut, we want to make sure we keep these guys happy. The third vitamin is vitamin D, actually. And I live in Ottawa. Right now it is the summer, so it's not too bad to get some vitamin D. But in the winter, the only thing that sees the sun out of my body is probably just my face. So obviously not enough. And I strongly suggest a patient to get their vitamin D level tested because the recommended 1 international unit is okay, but it's not enough if someone is deficient. So you may have to pay a little bit extra next time you go do your blood testing, but it's a small amount and it's well worth it, because if you are deficient or on the lower end, you really want to be able to replenish with higher numbers than just 1 international unit. And the last one is omega-3 fish oil. And why is that? Is because our North American diets are really high in omega-6, so our ratios of omega-3 and omega-6 become really imbalanced. We're talking 25:1, and really we should be looking at a 3:1 ratio. Why omega-3? Well, geez, it's good for the brain, it's good for inflammation or reduce inflammation, it's good for so many different things. So just to recap, the Fantastic Four that I believe people should not leave home without is a good multivitamin, probiotic, vitamin D, get your level tested to make sure you're not deficient, and lastly omega-3 to make sure that you have the good fats in your body and that your omega-3 and 6 ratios are well balanced. This was Dr. Nathalie Beauchamp, and I hope it answers your question on what basic vitamin everybody should take. Then you can go a little bit more specific if you have special needs and special situation. Thank you.